Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Melissa, and the question last week was part 5 of my 78-year-old mum has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. And if you're watching this on YouTube, just click on the link below this video and it'll get you to the website where you can check out all the other episodes. So in this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from my client Melissa, which are excerpts from phone and email counseling and consulting sessions with me. The question this week is part 6 of my 78-year-old mother has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it, or will she need a tracheostomy? You can also find previous questions answered from Melissa when you're clicking on the links below this video. So Melissa writes, "Hi Patrick, I hope you remember us. My dad and I had contacted you about my mum a few weeks ago. The hospital had not wanted to do anything for her. I really hope you remember us. Unfortunately, my mum is back in hospital. The tumor has grown again and she has fluids in the lungs, which is most likely from the cancer, but maybe from a bacterial infection or a pneumonia. Now it looks like it's starting all over again. Every time I go there, they ask, are we sure we want to keep my mother alive? The tumor has grown. Maybe she should not go on a breathing tube. We are insisting she should be put on a breathing tube if her breathing gets to the point where she cannot do it on her own. Is that what you would advise? The tumor has grown quite significantly, but I don't like to give up, and I know she wants to fight because in the past she has voiced her wishes. The hospital, like last time, is telling us she will not get better and will most likely die in the next few weeks. I don't want to be in denial, but I still want them to do everything they can. The hospital makes me feel like an awful person. Sometimes by asking for that, I really don't get it. I'm certain we can't be the only ones who think like this. Maybe they just think it's too late, but it's getting to the point where I dread even visiting her because some nurse or doctor will grab me and ask me the same questions over and over again. I hope I'm not being selfish. Have you ever heard this from other families who had a family member with lung cancer and fluids in the lungs? What are your thoughts?" From Melissa. And before I get into my response, if you're watching this or listening to this and you want to get one-on-one counseling and consulting with me, just check out the one-on-one counseling and consulting session options at the top of the website and choose from the option that works best for you. So here's my response. "Hi Melissa, of course I remember you, your mum and your dad. I'm very sorry to hear that your mum is back in hospital. You are certainly not the only one who wants to keep your loved one alive against medical quote-unquote expert advice. It's just normal for families wanting to do the right thing. And it's almost quote-unquote normal for doctors in intensive care wanting to pull the plug or to withdraw treatment against the family's wish. I have seen it over and over again. In nearly 20 years intensive care nursing experience in 3 different countries, where I also worked as a nurse unit manager for over 5 years. Intensive care is a highly political environment, therefore life or death decisions are almost always made due to what's happening behind the scenes in intensive care and not necessarily due to medical facts. If families in intensive care don't question, if they don't do their own research, and if they take everything the intensive care team is telling them for face value, they are doomed. As a matter of fact, 99% of families of critically ill patients in intensive care don't make informed decisions They don't have peace of mind, they don't have power, nor do they have control and influence. I know you and your dad have already proven to be in the 1% bracket of families in intensive care, and I know you leave no stone unturned in order to make informed decisions, get peace of mind, control, power and influence. Give yourself a pat on your back for doing that. The next problem that families in intensive care are facing is that they feel intimidated by the perceived power and the perceived authority of the intensive care team, and they need to stop doing that. I know you followed my newsletter and you have looked at the questions that people ask, and it's often the same over and over again. Families wanting one thing and hospitals and intensive care units want another thing. That's all we do day in and day out, successfully advise families in intensive care how to get what they want. We are the experts at positioning, diagnosis, prognosis, as well as care and treatment. We have more than once successfully reversed DNR, do not resuscitate, or NFR, not for resuscitation orders, and we have more than once saved, or at a bare minimum, prolonged lives for patients in intensive care by stopping the intensive care team to withdraw treatment. You can find enough case studies on my blog with evidence for that. I have also written an entire ebook about the subject, how to successfully reverse DNR, do not resuscitate, or NFR, not for resuscitation orders, as well as withdrawal of treatment decisions. And the title of the ebook is The 5 Things You Need to Know if the medical team in intensive care wants to limit treatment, withdraw treatment, or withdraw life support, or issue a DNR or NFR order for your critically ill loved one. Looking at your mum's situation in detail, I know she has been fighting many battles, including tracheostomy ventilation in the past, and then subsequently weaning off it. It sounds like she has come fine through all of those challenges. If she has fluids in the lungs now, it could well be from a pneumonia, as you mentioned, or from the tumor. It could also be because of kidney failure, but you haven't mentioned anything about that. You didn't mention if your mum had chemotherapy in recent months, and I assume it hasn't been the case, given you haven't mentioned it. I do remember when I first counseled and consulted you earlier in the year that you mentioned your mum having had chemotherapy, but I don't think she had it since. Now, given her current situation, if she has fluids on the lungs, due to either a pneumonia or due to the recurring tumor, she may end up on the breathing tube and the ventilator if her oxygen levels are dangerously low. To put this in perspective, if your mum's oxygen saturation levels drop below 90%, even though she might be on oxygen, she will need to either go on BiPAP ventilation with a mask, and if that's not sufficient, she will need intubation and ventilation with a breathing tube. Other things to look for are the results of your mother's arterial blood gases. What do I mean by that? In order to establish how well her gas exchange is in her body, they may have already inserted an arterial catheter to regularly check arterial blood gases. If they haven't inserted an arterial catheter, they are not monitoring your mum's gas exchange to the best of their abilities. Gas exchange in the blood can be monitored with an arterial catheter, and oxygen as well as carbon dioxide levels can be measured in the blood. And depending on the numbers, BiPAP ventilation with a mask or intubation with a breathing tube and ventilation may need to follow. If they haven't inserted an arterial catheter, they might already be thinking about not giving your mother best as well as standard treatment, and she may already lose precious time if they're not monitoring and treating her appropriately. For example, if oxygen levels, also known as PO2 levels in the blood, are less than 65 mm per mercury, and if carbon dioxide, also known as PCO2 levels in the blood, are more than 45 mm per mercury, It suggests that her breathing and gas exchange is inadequate and that she will need BiPAP ventilation with a mask or intubation and ventilation with a breathing tube. And that's why it's really advantageous to hire someone like me, because I can help you asking all the right questions so that there is no hiding for the intensive care team. The next steps really are that if your mother's breathing is rapidly deteriorating, that she may need BiPAP ventilation with a mask, and if that's not sufficient, she will need intubation and ventilation with a breathing tube. One way or another, if she has either, it will buy her time to see where things are going, and you can also be certain that if they do it, that she can be kept alive for a period of time. That doesn't mean they can necessarily save her life if the tumor is growing, but it could mean that you can spend more time with her and you can also ask her what she wants. As long as your mother is awake and alert, I think you should ask her what she wants and if she wants to continue fighting. As long as that's the case, you should make this very clear to the doctors and the nurses in ICU, especially if your mum is getting more and more weak and she can't express it herself. If you and your family want to prolong her life, please also make sure her suffering is limited and also advocate for pain therapy and potentially palliative care and comfort care. At this point in time, your next steps are to, number 1, establish with your mum what she exactly wants. Number 2, make sure they have inserted an arterial catheter to monitor her arterial blood gases. An arterial catheter is usually inserted in the wrist or in the groin. Next, number 3, get exact chest X-ray results. Number 4, potentially ask for a CT scan of the chest. And number 5, get arterial blood gas results. Number 6, make sure the intensive care team is giving you options such as BiPAP ventilation with a mask, and if that's not sufficient, your mother will need intubation and ventilation with a breathing tube. Number 7, make sure your mother is remaining comfortable and not in pain. She would have a pain team involved in her care, hopefully. And number 9, speak to her oncologist and get his views as well. As you know by now, nobody can force you or your mum to withdraw treatment against your will and against your wishes. But it sounds like you are in for another battle to get what you want, and I'm here to help, of course. Don't feel bad about restating and reaffirming what you want. It's your right, and as you know, the intensive care team has their own hidden agenda. Therefore, you do whatever you feel is right for your mum and for your family. The hospital and the doctors and the nurses only want you to feel bad because they don't want your mum to stay in intensive care for much longer, something we have discussed before, and something that I keep mentioning over and over again, and I also explain it in detail in my emails and my videos. As you know, intensive care beds are in huge demand. Therefore, the worst case scenario for intensive care units is to have patients in intensive care for longer than they want them to be in it, because they need the beds and the staff. Furthermore, they don't want to deal with you and your family because they know by now that you and your family are quote-unquote difficult and demanding, and so you should. As you know, it doesn't matter what other people think. As a matter of fact, it's none of your business what other people think about you. Keep that in mind at all times. All that matters is your mum, and if neither she or you and your family are ready to give up, you should make that clear in no uncertain terms. I have given you the first steps in what to do and in what to look for, so make sure they are doing all the right things, and I'm looking forward to your next update. Many thanks from Patrick. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions, or you can call us, find international phone numbers on the top of the website. Also check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.